All right. Hello, everyone, and welcome to the ADHD Summit panel with our change makers on ADHD today. I'm happy to be joined by four amazing panelists, which I will now introduce to each of you. So starting with Dr. Megan Druet. Dr. Megan Druet has a major passion for the human mind, body, and spirit, and loves researching ways to optimize your life. She is dedicated to understanding the cause of illness and educating her patients to help them make the most informed, least invasive decisions regarding their health. Dr. Druet will be answering questions about natural solutions for ADHD and how you can leverage lifestyle, supplements, nutrition, and herbal medicine to optimize brain health and executive function. She will also answer questions about emotional disturbances associated with ADHD, such as anxiety, depression, RSD, trauma, and more. And lastly, she is a huge fan of sound medicine and using sound to elicit focus and relaxation. So feel free to ask her any questions about how you can use sound medicine to cope with the symptoms of ADHD. Next, we have Kunal Pathade. So Kunal will be answering questions about finding career success and academic success for people and students with ADHD. He will share his experience as both a corporate employee at a bank and as a creative entrepreneur. He's passionate about self-improvement, finding ways to work with your ADHD, and making lifestyle changes to manage mental health and enhance productivity. Kunal is an expert on productivity and reaching your full potential with ADHD, anxiety, and depression. He will answer all your questions about how you can live a successful and balanced life while prioritizing your mental health. A little bit more about Kunal. That Kunal battles with diagnosed ADHD, anxiety, and depression on a daily basis. He currently works a day job as a finance professional while running his own business. And after being dismissed twice by healthcare professionals, he fought for himself and got diagnosed with ADHD at 22 years old, which represented a turning point in his life. Kunal passionately talks about his personal journey, ADHD and anxiety management tools, and productivity tips on his platform of 300,000 across all social media, TikTok, Instagram, TikTok Kunal Pathade 1, and Instagram ADHD Life Hacks 1. Next, we have Dr. Lucrezi Rupert. So about Dr. Lucrezi, she's a child, adolescent, and adult psychiatrist who currently practices at Gunderson Health System. She specializes in neurodiversity, ADHD, autism, learning differences, etc., children with trauma, children in foster care or who have been adopted, and adults with developmental disabilities. Dr. Lucrezi will be answering questions about how to improve relationships in the context of ADHD and how to handle emotional regulation and disturbances. She has lots of experience with all aspects of coping with ADHD, from parenting and coaching to treatments to academic success and accommodations. And lastly, we have Eric Whittington. Eric was diagnosed with ADHD at 7 years old and was lucky enough to have a support system for his atypical brain through most of his life. He decided to start creating content about ADHD and how to live the best life they can by improving their executive function and the skills that support it. Eric's content has been generating lots of awareness. It is really rewarding for him when he hears from people who have made appointments with psychiatrists to finally begin managing their symptoms. These moments motivate him to keep on promoting awareness and sharing how people can manage their ADHD symptoms. Eric will be answering questions about how executive functioning plays a role in almost every facet of our lives. Many people are just now beginning to understand why life has been so much more challenging for them than for those around them. It is clear that awareness and ADHD management has a long way to go. So take this opportunity to ask Eric about executive functioning and what you can do to take action steps and manage your ADHD. So now that we have people trickling in over here, I want to direct all of your attention to the chat. I'm going to share a Slido where you can ask all of your questions and see all the questions that have been asked. So I'd encourage you all to have a look before asking your question, as there might have already been a question asked. And if it is already asked, you can upvote it next to the question, and that will bring it to the top of the list. So the more upvotes the questions have, the more likely they will be answered on this panel. So with that said, I will go ahead and get started with the first question on our list, which was asked by Jen Libby. How do you understand what kinds of intervention a child needs when they have behavioral issues? And the floor is open for anyone who wants to take that.
So I guess I'll go first. So I really just evaluate the child. Like I'm very, I do a very personalized kind of interventions. So normally I'm a psychiatrist, so I'm seeing kids. Most of my patients I prescribe medications for, but not all of them. I generally also attend like IEP meetings if they're on an IEP or 504 plan. If they have any other supports, I meet with whoever is on their team. So I really just look at symptom-wise. Is this kid having inattention problems? Do we need to work on both medicines and or other ways to solve inattention? Is it an impulsivity issue? Is it a hyperactivity issue? And then we just come up with a personalized plan, really for each kid. I mean, there's a saying in the autistic world, you know, I'm ADHD and autistic. There's a saying in autistic work, if you meet one person with autism, you met one person with autism. Well, that's also true for ADHD. So really, you just have to look at the child or the adult, the person before you, and see what their needs are and develop a plan for that person.
Great, thank you. Anybody else want to tackle that question? All right. So moving on to the next question from Hage Levy. Which innovative tools are emerging to enhance patient engagement and adherence during the initial years of treatment?
I'm guessing they mean innovative tools as in like apps and things like that. Like I know there are apps that can remind you to take the medication. There's actually medication dispensers that will sound an alarm and won't stop the alarm until you like release the pills or take the pills out of it. I mean, for ADHD people, I think calendars on your phone has been a huge one. So just putting like all of your appointments on your phone. Auto pay has been a huge one for me because I was actually in medical school when this happened. I have come home to my lights being turned off, not because I didn't have the money, but because I just didn't pay it for 2 months because I don't know what was going on. So auto pay, I don't know do other people have other kind of technology things that have been helpful for them? I'll let other people talk.
So I can't think of specific tools, but in general, I think it's becoming easier and easier as you know the years progress to leverage technology to externalize things. And I think the people who to be successful with ADHD, one key is to externalize as much as possible. So I think just, even something like I use Google Drive religiously. Something like Google Drive can be such a useful resource to offload as much as possible from your, the executive functioning. I like to think in extremes, and this is probably going to drive the doctors a little crazy throughout this Q&A. But one thing I tell people is like a good exercise that you can do is to think about, like, imagine if somebody were to remove the parts of your brain completely responsible for your executive functions, like organizing, prioritizing, your working memory. What would you set up around you in order to then, go about your life and use that as a starting point? So yeah, with that, just Google Drive is a great resource. It's not new, but just using as much as possible. Another tool that I've used and had success with, and I've heard lots of other people using, is Alexa or Google Home with like lights in your environment. So not only setting up a reminder, but actually having a light up or change colors depending on what you have to do at a certain time of day, something like that.
Awesome. Those are great recommendations. Oh, go ahead.
Okay. As someone who got diagnosed at a later age, it was crucial for me to find some of these tools that help me. And personally, as much stigma as there is around using your phone, I've actually found the phone to be the number one most helpful and most hurtful way of managing ADHD because of all the distractions. But like using your phone to your advantage, like setting alarms, like Dr. Rupert said, to remember to eat lunch, remember to eat breakfast. Putting appointments on the calendar right after you schedule them, and setting reminders. And then also, so if you're into technology and you like productivity tools, Notion, it's a little bit overwhelming to get into it, but once you actually start exploring it, you can honestly have your whole life kind of in Notion. And yeah, I've been big on like Notion. I also use Google Drive as well, but honestly, Google Calendar, like time blocking throughout the day, like you're gonna eat breakfast, you're gonna check emails, you're gonna do this. You're putting it on a calendar really helps, like especially because like with ADHD, we're more visual people, at least we tend to be. So yeah.
I just want to say something real quick. You said eat breakfast. I think that is important. Even things that don't, you wouldn't imagine everybody using their Google Calendar for. It's something like eating breakfast. That's great, right? Like showering at this time of day, eating breakfast at this time of day. What you're going to eat for breakfast throughout the week. That level of detail, I think, is really helpful.
There's something else that I do that's actually not technology related, or I guess it can be now. But something I've always done is work with other people in tandem. And I think TikTok has like a name for it now, but I don't know the TikTok name. This is just what I've always done. Is I work better when I'm working with someone else, even if we're not doing the same thing. So even if we're working on different things in the same place. So I have like a friend who works from home. So sometimes I'll just like call him and we'll literally just be on the phone doing our separate jobs. But it helps me focus because I don't know, it just helps me focus. And that's one thing that I, when I was younger, I wasn't diagnosed till actually I was in residency. So when I was younger, I always had study groups and things like that. And once you become an adult, like a study group isn't a thing. And that's when I realized, wow, I really was getting by a lot of things because I had like these external people to help me, manage things. And I had to kind of discover how to do that for myself. So Zoom meetings, sometimes I just do a Zoom meeting with a couple of people that we all have projects doing. We just all, somebody says called body doubling. Yeah, so we all just get on and work together. And I think that's one of the most helpful things for me as far as like completing projects. Because, we can all start projects, but completing them is a different story.
Megan, any thoughts?
Yeah, I was just gonna echo those same sentiments. Body doubling. Yes, I could feel we were all restraining ourselves. It's body doubling. It's body doubling. We all wanted to say it. But yeah, no, I have found that one hugely helpful. Just having that other person there, just sort of mirroring this, productivity that you're trying to get done has been immensely helpful, especially when it's really cognitively demanding tasks. Just having that person there just really, really helps motivate you. So huge fan of body doubling, huge fan.
Awesome. And, I think really what the question is getting at here is how do we use technology or any other tool strategy to supplement the things that we aren't as good at? And, one of the things that we'd be really curious about, we've got some team members here who can set some polls. So we're going to create some polls in the Slido, and we'd love to hear, what are the kinds of things that you guys are struggling with the most that you would like to have a tool for, or that you would like a strategy or solution for, because that's what we're all about at SmartCourse. And obviously we want to include as many of those things as possible. Okay, so moving on.
I just want to say something real quick. I saw somebody that said, but if you get used to that and it stops working. So something I do really with medicines, but it works with other things, is I might have a patient who does well on a medicine and stop working, or does well with a therapeutic intervention and stops working, and then they do well with another one. So I kind of switch those two things back and forth instead of adding and adding. So say you do well with body doubling and that stops working. So then you do well with calendars for a while and that stops working. I would just go back and forth between the two instead of always trying to find new things. Because normally once you're not used to it, it starts back working again. I just want to say that real quick.
Yeah, I just want to add to that too. I think it's important to understand that whatever you're doing today and works for you, there's a good chance that it's not going to continue to work after a little time. So just having that expectation when you establish a plan or set up a tool, and keeping in mind that you'll likely need to evolve it, and that's okay. Which is also why I'm a big fan of tools like Google Drive that, allow more flexibility than something like, an app that you download that's going to help you manage, your life. That's static, right? It's probably going to be difficult when you start to get used to, or not used to that, bored of it. I don't know. When you start to not want to use that app anymore, you can't really do much with it. So, as you are, you get that rush of motivation to set something up, that we all get from time to time. Make sure in that point you consider that, like, whatever it is, you should have a way to, stick something new onto it, remove something, just adapt it a little bit, so that you can be flexible as you, go through those phases.
Absolutely.
Yeah.
And I just wanted to add to, I wanted to give a shout out to Focus Mates. I'm a huge fan of Focus Mates for body doubling. It's like a very cheap monthly subscription, and you get to body double with different people every single time. So there's the, element of novelty a little bit each time, but I've found that immensely helpful. Focusmates.com.
I completely agree with Eric and Dr. Lucrezi about like evolving the habits you do. And I think it's just common for us with ADHD to lose interest in something once it stops providing that constant source of dopamine. So you're trying to find the new thing to substitute in place of that. And honestly, for me, it's like with working out. Like I tried so hard to get on a consistent workout routine over the last like 4 years. No, I had no success until like this year. And it's only because like one day I'll do high intensity interval training. The next day I'll go lifting. The next day I'll just go on a walk. Like I guys like alternated in a way where it's like you're still getting exercise and still it's so good for you. So yeah, it's just important to like realize that if it stops working, then you have like a tool set kind of, and you kind of find a way to get the similar effect from using a different tool. And then I saw the same question about like, does that apply to jobs and careers too? Honestly, it tends, yes. I mean, yes, I would not recommend it. It's not like I'm recommending it, but it is common for people with ADHD to job hop, or like just maybe not find one job working out. They go find another one, and it's a trend. So if you are doing that, there should be no like shame around it. I even in my current job, like so I work at a bank, and for the last 2 years I was in one group, and then I switched to this other group, and I'm already thinking of switching to another group. And it's not because I like don't like it, it's just because I constantly like I'm just constantly finding like new things that interest me. So I think it's natural to have like to change your career path like multiple times like throughout your lifetime. So yeah, you shouldn't feel bad about that. You're a med student, yeah. Well, I'm not sure in that case, because I haven't got to med school, but I'm sure some of the doctors can speak to that.
So just real quick, for a med student, I mean, obviously it's really hard to change careers once you pick your specialty, because you have to redo a residency. But I think picking a specialty with novelty, so I'm a psychiatrist, but every person is different. So there's always new things for me to do. A lot of people with ADHD are good in the ER, P's, because every kid is different. So I think picking jobs that, even though you can't necessarily change specialty or don't want a job hop, there's still a job hop. Okay, I'm sorry. There's still a lot of different things you can do. Like I can do so many things with my career. That's not, I mean, it's just being a psychiatrist or being, certain specialties within the medical career are more likely to just where you could do different things and keep that interest going. I never get bored as a psychiatrist. I never get bored with my patients. I think we all get bored and irritated with administrative stuff in every field, but but not the patients.
I can't speak to the medical side of it, but just from personal experience, I worked at larger corporate companies and a few startups. And in the startup world, my job was like constantly changing, and I had a lot of flexibility to change it. So as my interests were, going in different directions, I was able to contribute. So yeah, not just bouncing job to job, but there are a lot of jobs out there that will give you flexibility to, keep you engaged and interested. Excuse me, and interested.
Absolutely. And just a reminder for everybody listening, we are going to be periodically reposting the Slido in the chat for new attendees. But if you have any questions, please put them in the Slido because that's how we're going to ask them, not directly through the chat. All right, next question is from Jimmy McDaniels for Megan Druet. How does sound therapy help focus for ADHD? Can students listen to music and study at the same time? It seems this would be a distraction for someone with ADHD.
Excellent question. So I literally have two Spotify playlists. One is pre-focus and one is focus. So on my focus one, I actually like to listen to music while I'm working or doing cognitively demanding tasks, but I only select songs that have no lyrics. There is a lot of evidence behind, especially certain types of classical music that can actually increase our focus, increase our executive functioning, increase our stamina. And I love to leverage sound while I'm working, but I also, before I know I have either a cognitively demanding task or something that's going to be super boring, I put my pre-focus one, which, it's just to really, get that dopamine going. Because as we know, exciting music that we love will increase our dopamine levels, and it's going to get you nice and pumped and stimulated for whatever you have to do. So for my pre-focus one, that's all my fun songs, my songs that I love. And, as we know, ADHDers, sometimes we like to change the songs we love. We love to listen to that one song for a week and then change it to the next one. But yeah, so I like to sort of categorize like a pre-focus music list that I listen to with lyrics. And then while I'm doing work or cognitively demanding tasks, I use non-lyric based sounds. And I find this extremely helpful just to sustain my focus and allow me to ultimately complete my task a little bit faster and better. So yeah.
We'll completely second that. Does anybody else want to share their thoughts on this question?
Just, yeah, totally. If I cannot listen to music with lyrics and focus, but if there are no lyrics, then yeah, that's helpful.
I found this.
I'm sorry. You could go.
Oh, okay. Just really quick. Look up white noise and look up brown noise. I cannot tell you how much success I've had. They just help you kind of like drown out like the surroundings and all the distractions in your brain. Like those two have drastically changed. Like there's 3-hour Spotify playlists. Just type in white noise or brown noise. It helps me sleep. It helps me concentrate. It's honestly like a life hack.
Yeah, I was just gonna say for students or for kids, definitely at home you could do this. I've actually tried to get things like this implemented in the IEP, not had a lot of success, but it's something to bring up in IEP meetings if your kid does better with doing study hall or rather working, if they're maybe can be allowed to put on headsets. Schools really push back on that because of distraction, but it's not distraction for that patient. But I think if more people start bringing that up, then maybe that will become more normal. So I still keep pushing it, even though I haven't had a lot of success as of yet, but still keep pushing it.
Awesome. So once again, please check the Slido and ask your questions there. This meeting will be recorded, so you will be able to access it after this panel as well. Okay, so for the next question, anonymous question here is there a link between ADHD and anxiety? How can you tell the difference between unmanaged ADHD symptoms, i.e. need for med, bump / change, and anxiety?
I'll start. So there is a link between ADHD and anxiety, and it is sometimes hard to tell the difference. What I generally do is, I'm sorry, a child just distracted me. What I generally do is I try to figure out if that anxiety is related to ADHD symptoms. Like, are you always worried about school because you're late turning in your homework or you're forgetting things? Are you always worried about getting in trouble because you're, forgetting to do your chores? So if I think it's more related to ADHD, then I treat the ADHD. If I'm not sure, sometimes I start treating the anxiety first because ADHD meds or stimulants can make anxiety worse. So I want to have something on board if you already have anxiety before I put something on board that might make your anxiety worse. So if I'm not sure, sometimes I treat the anxiety first, but if I'm pretty sure it's ADHD, I treat the ADHD first. And if there's still anxiety symptoms left over, then I treat that.
I can speak from personal experience on that one. So I developed an anxiety disorder when I was younger. And to paint that picture, when I was going into 5th grade, I was basically illiterate and, you know, hiding that as best I could from everybody. And as, you know, a kid surrounded by peers that can read and write and understand things, and I not able to do that, and having a, you know, deathly fear of being found out by my teachers, by my friends, you know, by my family. It's a lot of weight, it's a lot of pressure. And I think a lot of kids deal with ADHD deal with similar things. You know, it's just a matter of looking at your neighbor and the sense that, you know, they are understanding things that you aren't, and that's not okay, you know, in your mind. And for me, even though I knew I had ADHD, that wasn't like it wasn't like, oh, it's because I have ADHD, that's fine, right? It's still, you know, very well, it created an anxiety disorder in me, and that didn't, I wasn't able to resolve that and start working through that until much later in life. It persisted through high school and college, and it wasn't until out of college that I started to, you know, work on removing that from my life. Not the illiteracy, just the anxiety.
I actually have a question for you, Eric, if that's
Yeah.
okay. So, and this, I have both of my children are neurodiverse. Obviously, I work with neurodiverse people. I'm neurodiverse, but my patients that are behind are my kids too, that are behind.
Yeah.
But I'm pretty sure they have that ability. So of course, if you are not super well off financially, educational things might be really limited to like what's available at your public school. Like you might not be able to do private school or hire a tutor or whatever. So what helped you kind of catch up? And what would be your, I guess, recommendations for kids that can do it, but maybe need different learnings and schools aren't amenable to that? So what recommendations do you have for parents?
It's a tough one. So what happened for me in my life, I went into I actually tested into the gifted and talented program in 7th grade, and then subsequently failed all my classes and had to retake 7th grade, went to a different school, and then my family moved across the country. And for me, there was something about that, the new environment of, you know, a little bit with that move from one school to another, and then that move across the country where I literally knew no one. It was almost like a reset on my life. And for whatever reason, I, from that point on, was able to, you know, start to figure some of these things out. And I know that's of course a function of maturity, but I think that total change in environment definitely had a big part of it. So I don't know if that's helpful, but I think there's something there that I haven't yet been able to, you know, drill into thoroughly and understand completely.
So like for my son, just to get a little personal, he's behind academically, but I know that he has the ability to do these things.
Yeah.
And I just signed him up for a program that's $800 a month. That's a homeschooling program that actually I can't even afford it as a doctor, but they have a waiver that has like, you know, been able to apply. I've been able to use the funds from the waiver to pay for this, but everybody doesn't have a waiver. Everybody doesn't have 800 a month. So I just, and this could be anybody, even if you just want to put it in chat, because I think a lot of parents want to know, like that one-on-one really, not only is it one-on-one, but it's the one-on-one and the fact that it's telesite, because he gets really anxious with somebody that's one-on-one in person, right? So it's like all of these little different things that maybe come together perfectly to help him, but without those resources, I don't know. Like now I feel confident that he will graduate, and if he wants to go to college, he could go. But without that resource, I don't know that he ever would have, you know, gotten a diploma versus a certificate. So I think if you just have recommendations from anybody and want to put them in the chat, I think lots of parents just want to figure out how to best help their kids with the resources that they have.
Absolutely. Does anybody else want to tackle this question before we move on to the next? All right. By the way, thank you, Eric and Dr. Lucrezi, for being so open about that. So this is from Kath. What are effective strategies to help improve family dynamics, particularly the sibling relationship where one sibling has an ADHD diagnosis?
Adrian, can you repeat that question?
Yeah. So this is from Kath. What are effective strategies to help improve family dynamics, particularly the sibling relationship where one sibling has an ADHD diagnosis? And I can actually speak to this as well, to share a little bit about myself and my family. So it's, at least in my experience, been most effective with case by case, right? Approaching each individual as possible, and understanding that everybody's going to have very different needs, very different communication styles, very different ways of resolving conflicts. And so understanding that and approaching it from a collaborative approach, as opposed to the parents determining exactly what to do in their mind, has been very effective. And so something that I could highly recommend for anyone listening, we have a masterclass with Dr. Ross Green on his collaborative and proactive solutions model, which is something I would have highly benefited from as a child. And so taking that approach of getting the perspective of each of the different individuals and what they would like to see happen is going to be very helpful. And then also understanding that kids do well if they can. So if you are expecting the worst, it's probably making things worse. Whereas if you're promoting the best and understanding that, you know, everybody wants to do well, nobody likes to do poorly, that will help resolve a lot of the conflicts as well.
And I want to add to that. I think one thing that helps is accountability, but the healthy amount of accountability. Sometimes you see in parents with kids with disabilities or neurodiversity that nothing they do is their fault. It's all the disability, right? Like, kids are smart. They, disability or not, they're going to figure out how to make things work in their favor, right? And then there's the other kind of end of the spectrum where I don't care if you have ADHD, like, you should be able to do whatever, which isn't always true either. So, you know, your disability might be an explanation, but it's not an excuse. So I use me as an example. I can be very impulsive with my words. And when I say that, like, if somebody says something that I don't agree and we're having like a discussion, I'll jump in because I need you to know, like, what I'm trying to say right now. Like, I need you to understand what I'm saying. Like, I don't feel like you understand what I'm saying. And so that's perceived as like not caring what the other person has to say, or like taking over the conversation. So I give my friends and my family and my children permission to say, like, stop, or take a breath, or I need to finish my sentence. You know, long as they don't say shut up, because that doesn't normally go over well, right? But I give them permission to give me prompts to get my impulse control back together, right? So it's kind of like basically what Adrian is saying, that collaborative approach, but also understanding that you can't just say, well, I'm ADHD, I'm impulsive, you just got to deal with it. That's not okay either. But how can you work with a collaborative approach? Like, I'm going to be impulsive. I don't want to be impulsive, but that's how my brain works. So how can you call me out on that in a way that's healthy and will allow me to kind of reset? So basically, you know, that external boundaries kind of thing.
Absolutely. Anyone else? One quick note that I'll also share is, I think really what this question is getting at is what to do when relationships are in balance, where one partner has ADHD and one does not. And it could apply in a sibling relationship. It could be a parent-child relationship. It could be a spousal relationship. All of those things matter, and they have very different dynamics. We have a couple of master classes with Melissa Orlov, who is definitely one of the thought leaders in that space, how ADHD impacts relationships, that dives into all of those. So I'd highly recommend that. Okay, moving on. We have another question here from Anonymous. My previous therapist focused on CBT. He recommended humanistic therapy, which I have never heard of before. Have any of you had this form of therapy? What's the difference?
Was the first one CBT or CBT or CPT?
CB, yeah, B as in bird.
Okay. Yeah, I don't know what humanistic therapy is.
I have also never heard of this. So what we would recommend, I guess, is to definitely do your own research and look into that, because that seems a little bit weird. And I'm not sure how to answer that question. Okay, so we're going to move on to the next. Okay, so here's a follow-up question from Janet. How do you help students that take ADHD medication, but it makes their anxiety a lot worse? It's a tough question.
So treat the anxiety, whether that's with meds, whether that's with therapy, relaxation techniques, magnesium. I know Dr. Druet is, the naturopath, so she probably knows more about other things, but magnesium, over-the-counter magnesium supplements help anxiety. So there's, I treat the anxiety, because most of the time they can't come off. Or I'm not gonna say they can't come off the meds like ever, but at that moment they need them. So we just have to treat the anxiety.
Mhm. Yeah, and from my understanding, again, there's a lot of people who have to go through a bit of trial and error with certain medications. Not every medication is going to work for every single person. So you've got to really make sure you're paying attention to the benefits you're having and the side effects you're having. And if the side effects are really outweighing the benefits, then perhaps it's either the wrong dose or the wrong medication. So in situations where, say, there are a lot of benefits with just a little bit of side effects, that's when I like to be like, okay, this is awesome. Let's leverage supplementation. Let's leverage lifestyle in order to help reduce whatever that side effect is, whether it's anxiety or insomnia. There's so many supplements that you can take, even just simple things like leveraging nature medicine, going in nature, going for walks. These can really help reduce our stress hormones and just promote well-being and more happiness, less anxiety. So it really depends, and it's a case-by-case basis, but there's so many different things you can leverage to optimize your symptoms.
And one more quick thing, I just want to say that there are a couple, there's not a lot, but there are a couple non-stimulant medications for ADHD. And most of those actually do also treat anxiety. Most of the non-stimulant medications for ADHD also treat anxiety. So if I have somebody that has really severe anxiety, sometimes I just use those instead of stimulants.
I want to share my experience because it's unique. I think I haven't heard a lot of people talk about this, and I don't know if it's normal. But when I was young, I started medication when I was like pretty young. Shortly after I got diagnosed with ADHD, my parents tried different things with me, and as a kid, I had a lot of the adverse effects, side effects of the medication. I lost a lot of weight, and I was already a super skinny kid. I had, just really bad, worse anxiety. I wasn't happy. I was irritable. Pretty much I tried a few different medications, stimulant and non-stimulant, and generally it just wasn't a good experience. As I got older, high school, college, I took medication on more of an as needed basis. Like if I had, midterms, finals, like I would start up my medication again. And again, not a good experience. Like I felt terrible while I was taking it, and it did, it helped me focus and all that. So I would take it around those times. But I took a sabbatical for like 8 years after I graduated, because I was like, yeah, I don't have to take these anymore. I don't want to. Then 8 years later with work, things started getting overwhelming. I was in an operations role, which as someone with ADHD, it was kind of like a sick joke. At times it felt that way. So I started up medication again, and for whatever reason, I was like 25 when I started again. No, a little older than that when I started up again. For whatever reason, I had no adverse effects. My sleep was always totally screwed up. My sleep was fine. My diet, my appetite was completely gone when I was a kid. I had no appetite issues as an adult. So all of the positive effects of the medication, I was experiencing those, but none of the negative effects. So yeah, again, I don't know if that's a normal experience, but it's that was my experience. So just wanted to throw that in.
Yeah,
So-
actually, oh, sorry, Eric, Adrian, you go.
Go ahead.
You sure? No, Eric, thank you for sharing that, your personal experience with it. So like I said, I was diagnosed like a couple of years ago, and I started on meds. And actually, a lot of what Dr. Druet said, I experienced like all the negative side effects a lot at the beginning, like loss of appetite, like insomnia, really bad anxiety, all of that. And it took realizing that long-term like lifestyle, like making changes in your lifestyle are real in combination with the meds will actually help both your ADHD and anxiety. And that is like, I'm still a work in progress, because when I first started, like, and then I was asking my doctor, oh, hey, these are not working, I need to get higher. And then I was like, why? Like, why do I need to go higher? And then I eventually started like incorporating like a workout routine. So I'd work out after like, after my meds wore off. I switched from extended release to immediate release. I found personally that extended was not working for me. It was messing up my sleep. Again, this is all subjective, so it's going to be different based on your experience. And then mindfulness throughout the day, like taking a break and going on a walk, like Dr. Druet said, like they help so much. Like going on a walk and like playing some music for 5 or 10 minutes, you come back feeling refreshed. And yeah, so, and then with eating, like I think Eric reiterated this about like high protein breakfast in the morning. I'm serious. Like I talk about that so much, but it's so important. Like it really sets the stage for the rest of your day. And you don't get that terrible feeling inside your stomach, or you don't get like as bad anxiety if you eat properly. And it's hard to eat while you're on them, I'll be honest. Like even lunch, like I tend to skip lunch, but if you're feeling that way and you're not eating lunch, then try substituting with a protein shake. Try a meal replacement that's more like maybe like liquids. It's like all based on personal experience. But I think the biggest thing for life lesson for me was that meds are not going to fix your ADHD. Like they're just not going to fix it. They're usually a short-term, they're short-term like Band-Aid, but meds in combination with long-term lifestyle changes will help you manage your ADHD for years to come.
That actually makes total sense. Just looking at, my mindset as a kid, and definitely not putting a priority on a lot of those things. Mindfulness, I didn't even know what that was. Eating right, like I didn't really care. Exercise, yeah, I got some exercise, but those are all things, of course, as an adult, like I thought about consciously. So yeah, I mean, maybe for me it was just a matter of all of those other factors that need to be in place for the medication to do its thing without experiencing the adverse effects. That was just a matter of not caring about it when I was a kid, or yeah. So yeah, interesting. Thanks for sharing that.
I just want to, so this sounds like we're all against medicines, but obviously I'm not against medicine because I was a psychiatrist, but I actually don't tolerate stimulants like now. They make my chronic fatigue and my depression worse. So that's fun. But so I'm actually not on anything for ADHD right now. Although I'm getting ready to start Quillbase soon, so y'all can follow me on Twitter and I'll let you know if it works. Because I was actually on other antidepressants and my depression is getting better, so I feel like I could switch one of them out. But anyway, where was I going with that? ADHD. Where I was going with that is so if you're not tolerating stimulants, like retrying in the future is fine, but in addition to all of the non-stimulant medications, if those don't work, definitely finding, and we've kind of said this over and over, but those external things that help. So right now, pretty much my ADHD is completely untreated. So all of my life right now is external things that can help. It's very obvious that my ADHD is untreated. So, that's still obvious, but I'm not, for the most part, like missing important things because I'm putting all of these external things in place, even with completely untreated ADHD, that's kind of helping me get by.
There are so many things I want to share about this question. Unfortunately, I don't think we'll have all of the time to cover it, but I'll give as short of an answer as I can because I know it's a very complicated and very important question. I think the biggest thing to understand is start with the science and just look at the statistics of legitimately what the rates are of success for each thing. So doing the research there and making your own decision about what's right for you from that. But then also understanding that there are multiple different strategies. And so we have 2 master classes, we have 3 master classes all about medications for different types of things and breaking down each of them. So it's a very complex topic. It definitely requires a lot of learning. But in a nutshell, right, it's understanding what medication and behavioral therapy combination would work best for you. What peaks and troughs are there during the medication coverage period for the prescription that you're using, and therefore how to complement that with other medications that do fit. So for eucanol, right, if extended release wasn't working because it affected sleep, something like that, right, to find a combo that works for you and your individual situation. Holistically, the combination of the medications and behavioral therapies is found to be the most effective approach. So if that's a good starting point, then I think that will help a lot. Okay, one question from Leo here. What are your best tips for self-emotional regulation for someone with ADHD?
One of my favorite tips for emotional regulation, it's one of the challenging ones for people with ADHD, but mindfulness. Like really, there's nothing that beats mindfulness. I can vouch for that clinically, and there's a slew of empirical evidence-based medicine like on PubMed that supports that notion as well. If you can sort of educate or sort of get someone with ADHD to just slowly tiptoe into the mindfulness waters, and if they can actually latch onto it, this creates very, very like distinct long-term success with emotional regulation. Like nothing beats mindfulness. Like, of course, when that is, and if it's complemented with like a healthy diet, getting some exercise, getting some sunlight, especially getting morning sunlight. I'm a huge fan of Dr. Andrew Huberman, and he always talks about getting that early morning sunrise is going to help sustain your focus and optimize your focus throughout the day, and also prime you to have better endogenous melatonin production at night. So you're going to fall asleep better. Morning sunlight, like just simple things. But yeah, mindfulness is my favorite thing though. So my answer.
So I want to just tag along with mindfulness, but as someone with ADHD, like for years, when people said mindfulness, I was like, just shut up with that. Like I have, and I'm not, I actually agree with it now, but I have ADHD. Like there's no mindfulness for me. But what was actually a really big breakthrough is actually Headspace. I have the app Headspace, and the guy on there said that mindfulness is really noticing your thoughts and then coming back to like whatever you're supposed to be thinking about, or like coming back to the breath or coming back. So the fact that I finally realized like I'm not supposed to have like nothing in my brain, because that will never ever happen. But okay, I noticed, oh, I veered off, so let me focus back on the breath, or oh, I veered off, so let me focus back on, whatever, my muscle relaxation or whatever I'm doing. That was, for me, that was very helpful, kind of life changing. Like, okay, mindfulness does make a little sense, and now I can do it a little easier. But a lot of times with ADHD, you think that means no thoughts at all, which is not feasible for somebody with ADHD. So we're just like, we don't want to hear that, right? But I want to share that because I found that was really helpful for me.
I'm glad you shared that, because that's actually the number one most, like, that was the hardest part about mindfulness for me. And I said mindfulness in a response earlier, but I've had so much trouble like practicing mindfulness, and it's because the whole idea around meditation and mindfulness practices it seems overwhelming to me. Because it's like, oh, you got to sit down for 20 minutes in the yoga position, and it really doesn't have to be like that. And that's what I've learned. So through my personal experience, like taking 2 or 3 minutes to just like shut down your computer, put on a timer, put on some like maybe white noise or something, and just sit there like for 3 minutes. That can help you. Like that can help your anxiety. That can kind of change the tone of your day. But also, like guided meditations have actually helped me, because when I tried to do them without any guide, like Dr. Rupert said, like my brain would just like, I would think like, oh, I'm not supposed to have any thoughts. Now I don't know. I defeated the whole purpose of it for me. But really, yeah, if you're trying to get into mindfulness and you don't know how to do it, I would recommend seriously just deep breathing. Like deep breathing is one place to start. Like breathing in 4, out 6. Like the key is to breathe out longer than you breathe in. But then also just like it can be 2 or 3 minutes. It doesn't have to be 20 minutes. It doesn't have to be 30 minutes. People who have done it for years are going to tell you, oh, I meditate 4 times a day. I do it 20 minutes. You don't have to do that. Just do whatever's manageable for you. Build a routine over time, and then you'll find it to be helpful.
Mindfulness is that's like the number one thing that if I could go back in time and talk to my young self about a technique, it would be mindfulness, because that's made such a huge difference in my life. And even I just drove from LA to Las Vegas, and that drive is just like, it can just be like, you know, the worst thing in the world when you're just, your self-talk in your head is just going nuts and you're sitting in traffic for 7 hours. But, you know, even just so sitting in your car, taking deep breaths, feeling the steering wheel in your hands, relaxing, looking around you, you know, enjoying the scenery, being in that moment, like that's mindfulness, right? It's not just about clearing everything out, like these guys have said. It's just, it's really using your senses to be in the moment. And that can be something as, you know, simple as, even if you're at work, if you're on your computer, you know, shutting down your computer, taking deep breaths, that's awesome. But if not, just feeling the keyboard on your fingers, you know, just like, there's so many little things you can do to be in the moment that collectively makes such a big difference. One other thing, I actually got this, a brand reached out to me. I have an affiliate link, but I'm not going to drop it or anything because I don't want you guys to think I'm just talking about this to get traffic to that link. But it's called, oh God, I don't, Muhara. It's like I don't even, God, I don't even know that. I'm gonna look it up. But what it does, it's a little straw, and you breathe in through your nose and out through the straw. And it's just a little tool that helps you slow down your breath. And I find that wearing this around my neck, like I'll just pop it in my mouth when I'm in the car, or just on, you know, sitting at my computer, and it helps me regulate my breath. And just because it's like, you know, it's attached to me, it's right here all the time. I play with it without thinking about it. I pop it in my mouth and I do breathing exercises. So that's been really helpful to get me to do, you know, a little mindfulness practice throughout the day, because of course, one of the biggest challenges with mindfulness is just not thinking about doing that as you go about your day, right? So yeah, I'm gonna figure out the name of this, and I'll throw the name of it in the chat. There's a few companies that make products like this, but this has been really helpful for me.
Awesome. So yeah, I think I second, third, fourth, fifth, everybody's perspectives here. It has definitely changed my life massively. I mean, it's not even close. And I think, you know, just speaking back to why this is important for emotional regulation is because what is happening when you're emotionally dysregulated is you're just being triggered, right, over and over again. And so you're reacting to things much more than you would if you were practicing the mindfulness in a way that slows all of that down. And then from my experience, I'm just speaking in the ways that it's impacted me, you notice the ways that your chest starts to tighten up, or your breath becomes shorter, or you feel tense in your shoulders, or whatever it is. And those little signals, now that, you know, I've been doing this for years, I can see those and realize, okay, I'm in a reactive state. I'm going to be emotionally dysregulated. I'm going to react, or I'm going to get triggered easily in this state. And so that's a tell for me, okay, I should take some time. I should do some meditation. I should go for that walk. I should take a bath, whatever it is. And so that's another really important point that I wanted to bring up with the mindfulness is it doesn't have to be meditation. And so there are all these different forms of mindfulness, and you just need to find what works for you. And as long as it's something that helps you, then it's doing its job. So all of these other attachments with, you know, guides and sitting down in the yoga position, all that, it doesn't really matter. And it all just comes down to what works best for you. Okay.
I did want to say one really quick thing. I'm sorry.
Yep.
So for kids, well, adults too, but especially kids that have ADHD they have ADHD, and then they're kids, so they already just don't have a great functioning prefrontal lobe, right? So it is okay. There are medicines that help with emotional dysregulation and impulsivity. Besides stimulants, obviously stimulants do too, but stimulants only last for a certain amount of time, right? So if your kid is really, really emotionally dysregulated, or an adult, and can't even implement these skills because they're so emotionally dysregulated, definitely talk to a physician. You can use meds to just calm things down so they're able to even learn the skills to implement. So I just want to say that too.
Absolutely.
I also just wanted to add on that too. Yeah, again, with kids, if it's harder and they're not up for the whole mindfulness thing, I've just had a couple of recent young boys that I was seeing, and both are doing immensely better. And their main symptom was like intense rage. And it was through a couple of antioxidants. I think I gave NAC to one, and pycnogenol. Pycnogenol is a very potent antioxidant and has a lot of benefits to reduce hyperactivity, to improve attention span. And it has been successful for me with some of my clients or patients to improve emotional regulation and prevent these crazy anger outbursts that were happening. So just wanted to share that as well.
I use NAC too, but I've never heard of the second one. So can you put that in the chat so I can, but yeah, I use NAC too for my patients.
Absolutely. Yeah. NAC is amazing. Pycnogenol. Yeah. Look it up. I'll type it in.
Awesome. Thank you. So for the next question, it's from Thomas for Eric. Have you improved executive functioning skills yourself, and how do you measure this change?
So for me, it was, there was a pivotal point in my life where I stopped trying to find tools and systems that other people have created and implement them in my own life, and started to construct my own systems and tools. So I'll get back to Google Drive. That's been probably the most used tool in my arsenal. But I started just creating systems for everything. So one thing that we've talked about a little bit is sorry, I lost my train of thought.
Executive functioning or improving your executive functioning skills yourself by creating your own system.
Yeah, so creating your own systems, not relying on creating your own systems, not relying on what other people have created, and putting something in place that is not just like, if you think about how everybody uses their calendar, you know, how your friends use their calendar, how your coworkers use their calendar, they put the meetings and the calls they need to remember. But it's okay to deviate from that and create your own, you know, extreme version of the calendar that incorporates pretty much everything that you have to do. Like, one thing that people with ADHD or struggle with executive functions in general, I think have a little bit of reluctance to do is put systems in place that fill all of those gaps that you have, that make day-to-day difficult, right? And it's not just about you in the office struggling to submit your report on time. It's about, you know, what you're doing at home, those gaps of time that, you know, 2 hours spent, you know, you're supposed to be looking up some emails, responding to emails, and the time is gone. Like, there's a lot you can fill in throughout your day, and you shouldn't be shy about taking it to an extreme, down to you know, planning how you're going to make a meal, right? So not just eat food at this time on the calendar, but like, here's my process for eating. Like, I'm going to take the dishes out first, prepare my meal. I'm going to do the dishes before I eat my meal, and then just having all of that laid out. You know, knowing that these are complex processes. It sounds simple because everybody eats all the time, but it's a complex process. So the more you start to dissolve that expectation that, like, there are tons of normal procedures that you do throughout your day that you don't really need to think about and improve, or you know, outline. The more you can get away from that, I think that's a good starting point. So you know, it's not just looking at your day in terms of, you know, oh, you know, I'm not submitting my assignments on time in school or at work. It's like, from the moment I get up, there are a lot of things that I do that I can, you know, reevaluate, improve, spend less mental energy on if I have a system in place, if I have tools in place. So to your question, that's what I did. I have a Google Drive that set up. I literally have my different a series of tasks that I have that I do on a recurring basis, and I pull that block into my day, and I create my schedule that way. And it's eating, it's getting ready, it's showering, it's dressing, and I use that. I refer to that. I have it on my phone, and I just go step by step, and that's made a huge difference for me, because it's allowed me to not, for one thing, not expend a lot of mental energy on all of these simple processes, but it's allowed me to be more efficient on those things as well, so I can focus on the more important, impactful things in my life.
Awesome, thank you. Does anybody else want to share about how they have improved executive functioning skills, whether for the people that you treat or yourself, and how you measure the change?
Yeah, I'll go. So honestly, a lot of the same what Eric said. I'm glad you brought that up. But for me, it was realizing that, like, with eating, I did the same thing. I don't just eat breakfast. I put like cook breakfast, take out the dishes, just get the ingredients, just everything I really need to do. But I felt so much shame around doing that. Like at my age, I'm like, why do I just have a 5-step plan of how to make breakfast? That's trivial. Like, I should be able to do that by now. But a big part of it was realizing that, hey, it's not like, don't beat yourself up for it, because as people with ADHD, we're already used to negative self-talk. We've already been trained to feel bad about certain habits or certain behaviors we've had all our lives. Don't make yourself feel worse for it. Instead, do what you need to do to improve your executive functioning. So yeah, just removing the shame around it. It's not shameful. Promise. Trust me, it's not shameful. And then second is what's actually helped me a lot is noise canceling headphones. And it's especially when I get into that funk of just like scrolling on my phone, and I just can't get up from it. I'm like, I know I need to be doing something. I know I need to do this and that, but I can't just get up from my bed. So like, I honestly, noise canceling headphones, they've helped me so much, because it kind of just, and then you play white noise or you play brown noise, and it just kind of like, it just makes you feel like, hey, it's not that hard to just stand up. And you're able to, like, once you stand up, you're able to continue like and do a lot of other things. So it sounds very simple, but it's like when you're standing up, you're more likely to be more observant. You'll find, oh, hey, I can do the laundry now. Oh, hey, I need to do the trash. Hey, I can do this. But when you're sitting down, you won't actually see all that stimuli around you. So that's personally helped me a lot. Yeah, loop earplugs are great too.
Agreed on the noise canceling headphones. That was, I pulled the trigger on some a few years ago, and it was absolutely worth the money for sure.
That's so worth it.
Yeah.
Dr. Druet or Dr. Rupert, anything to add?
I don't remember what the question was.
No worries. So it's, if you have improved your executive functioning skills for yourself or the people that you treat, and how do you measure the change?
It's so weird. It's almost like we have ADHD on this panel.
Like, I don't know what you're talking about. Have I improved? I guess it depends on what you mean by improve. Have I improved my ability to apply things to help me? Yes. My actual executive functioning, I mean, probably not. I mean, I guess some of it has improved just with maturity and age, right? But I use, so like at work, they put anything work related on my calendar. Like if I'm on call for the weekend, they put it on my Friday schedule. Because there has been incidences where I may have forgotten that I was on call, and that is obviously not a very good thing as a physician. If I need to make a phone call to a parent, put it on my schedule. Like if I have a meeting that's, you have a meeting with different admins, put it on my, like everything goes on my schedule. Everything. I have an actual accommodation like through IDEA, not IDEA, that's for kids. Through the ADA, I have a scribe as an accommodation for my ADHD. So that helps with not getting emails about how I need to finish my charts right now. So, like I said, I even use my patients sometimes. Like if they need me to fill out a paper, I'm like, I hear you saying this. I need you to send this to me through the portal so that I can see your request and not mark it as read until I actually do it. Like you telling me right now this appointment means nothing to me. So I use my patients, like send it to me through the portal. if I have not called you back by tomorrow to follow up on something, send me a message. So I use a lot of people as my external reminders, and I mean, it works great, but I have to use what I have to use.
So again, the question was essentially, have we improved our own executive function or that of clients or patients? Yes. It's amazing what foundations of health can do for you when, again, it depends who's coming to see you, where they're at. Sometimes there's a really poor diet, poor lifestyle habits, not exercising, drinking like 20 coffees a day to get through the day, ending up having like these huge crash and burns in the afternoon. And yeah, when you can really tend to the foundations of health and again, like other people have spoken about, getting enough protein throughout the day, getting enough protein for breakfast, getting the sunlight, getting outside, prioritizing your sleep, implementing proper sleep hygiene at night so that you can have a better sleep. And when we have a better sleep, we can consolidate memories better. Our brain will function better. It'll be happier. Yeah, make sure you really prioritize sleep, because every single night when you're sleeping, your brain actually shrinks and a lot of debris gets drained through your cerebrospinal fluid. And so the deeper you sleep, the more high quality sleep you have, the more debris that gets out, the better your brain will be functioning the next day. So yeah, tending to your the foundations of health, whilst also looking at what is individually going on in you. What do your blood results say? Like, do you have iron deficiency? That can impair your brain function. Iron is needed as a cofactor for dopamine production. So I like to really use an individual approach with people that I see, whether it's a kid, adult. But yes, your executive function absolutely can improve when leveraging lifestyle and trying to tend to all these factors. Yes.
Dr. Druet, how would you go about identifying what, like you mentioned, an iron deficiency? How would you go about discovering what you may need more of? Or would you recommend like working with a doctor on that?
Yeah. So you mean like how do you elicit what like the root cause is, or like if there's any primary root causes?
Yeah.
Yeah, very good question. So I do it based on, there's a lot of signs and symptomology. So how I do it, I have really comprehensive initial intakes where I'm going through every single system of your body. It's not just about your executive function. It's how is your lung functioning? How is your gut health? As we all know, there's a huge connection between our gut and our brain. And if there's a lot of dysbiosis or issues going on in your gut, this can impact your depression. This can impact anxiety. This can impact your executive functioning. So I really like to do a thorough comprehensive intake to see what's going on in the body. Let's do some standard blood testing. Is there anything off? Because as I've seen so many people, and there's always so many different types of root causes that can be going on and co-contributing to whatever symptoms you're experiencing. Yeah. Sometimes, like I had one random one a while back, they had a parasite infection, like their gut was off, and this was co-contributing or worsening their executive function. Yeah. Treated that. Again, the ADHD didn't go away, but there was an improvement in executive function. So this is why I'm very pro individualized treatment and trying to get someone who can see and look at all of your signs and symptomology to determine, okay, what are the best blood tests? What systems seem to be off? What can this mean? How is this all connected? So okay. That's kind of how I operate and how I sort of try and ultimately locate the root cause.
Got it. So would you say the best starting point is to talk to your doctor about it and try to,
yeah, if you can talk to your doctor, I'm a huge fan of like functional medicine too. That's very holistic, very comprehensive. But yeah, talk to anyone who can really look at your whole comprehensive, symptomology and what's going on so that they can really try and iron out what would be the best route to take in terms of treatment plan or further assessments or lab testing. Yeah.
Okay. Thank you.
Yeah, so this is the reason I wanted to get everybody's take on this is I think because EF skills are the foundation and really like it's not possible to improve any of the symptoms of ADHD without understanding executive function and executive skills. So I think it's a great question. One of the things I'll mention is actually, first of all, for Eric and Kunal, about the shame of having to do things differently, I think is something that a lot of people can relate to, but it's definitely, there's a positive side to it as well, meaning the more that I have used systems to help me outsource as much as possible from my brain to technology, the more it has freed me up to do things that I enjoy more and
Yes.
get better at them, right? And so for everybody to see that there is another side to that, which is, yes, you may have to do a little bit more upfront in some ways to better care for yourself, but it'll also allow you to do way more in the other things that you really care about. And so that's also something to keep in mind.
Yep.
And-
Yep. 100% agree with you. Yeah. The more you, and use the perfect word, outsource the more you outsource your executive functions, the more you open yourself up to do the stuff, that you enjoy, that you're good at, a lot of people, I like to refer to executive functions as what allows you to use your intelligence, right? They're two different functions. You could be highly intelligent, have low executive functions, vice versa. But when you have your executive functions, outsourced, being handled, that opens you up to then, do more with your brain, with your intelligence.
Yeah, and
Yeah.
towards that end, I would just make one quick recommendation of Atomic Habits, because I think there's a lot of parallels with the habit formations.
Mhm.
And so I'm gonna butcher this a bit, but just as something to keep in mind, the environments that we are in have certain triggers that then trigger us to do something over and over, and that is that habit formation happening. And so all of these things, creating the Google Calendar with extra detail, or having Alexa change the light in your room, or having reminders pop up at the right times. These are all ways for you to change your either physical or virtual environment to give you that trigger, so that you are then following what you've outsourced and you don't have to remember anymore.
Yep.
So I think these are all, there's a lot of parallels there that I'm just making now. And I think looking at something like habit formation or Atomic Habits would be very helpful for EF skills.
Yeah, I love that you brought up Atomic Habits. Like, honestly, like, abide by that book. Because it really, especially for people with ADHD, like, we tend to be like maybe focus on the results. Like, ultimately, I don't know a good example of this, but it's really about the systems you have in place. That's the main point of the book. Like, the systems you have in place help you achieve those results. If you say you want to read 20 books a year, that's so intimidating. Why don't you say you're going to read 10 pages a day? You'll end up reading, maybe you'll read like 10 books. Like who cares? It's really about like what you get from the book. So yeah, Atomic Habits has really helped me. And then also as a point about what Dr. Druet was saying about the gut, the mind, the body, the mind and the gut, sorry, how they're related. And from personal experience, like I actually, so shortly after my ADHD diagnosis, I got diagnosed with IBS. So, and then I realized that it was like my eating habits in place. It's like a whole realization. That's honestly, Dr. Huberman's podcast is so helpful. It just like you learn so much from it about like how the brain works. And when you know how the brain works, you're more like motivated to actually like improve your lifestyle. So for me personally, I found out it was my eating habits that were honestly triggered by like my ADHD meds that was kind of suppressing my appetite, and I had really unhealthy eating habits in place, also unhealthy ways of managing my stress, and that combined led to IBS. And I didn't even realize it was IBS for so long. And then once I started like the lifestyle changes I was mentioning, like eating the high protein breakfast, working out, having a workout routine, all of that stuff, mindfulness, I started seeing improvements in not only my ADHD, but in my productivity, but also in like my physical, my physique, and then also with IBS. Like I haven't had a flare up in like 8 months. So it's honestly like the diet is a lot more important than you probably think it is.
Absolutely. Okay, so in the next couple of minutes here, I'm going to take a couple more audience questions, and then I have some questions just in general about ADHD that I'd like to ask all of you. So next question, anonymous, is I need to know if health insurance offers services for kids with ADHD. My child got evaluated through her developmental doctor, but that's where it ends.
So yes, health insurance will cover seeing a psychiatrist. It covers seeing therapists. I also a lot of times so if you have ADHD, a lot of times you have sensory issues or fine motor issues. or social difficulties or things like that. So I send a lot of my patients to occupational therapy, because not only do they do fine motor issues, but they do a really good job with helping kids learn like how to recognize like I think Eric was saying earlier, like when he gets upset, like signs of your body when you're getting upset. So they help them a lot with emotional regulation, with learning how to recognize when they're about to be dysregulated, and skills to use when they're dysregulated. So I think occupational therapy is a very underused resource for kids with ADHD. So I send a lot of my kids there. Insurance pays for that. Depending on what type of insurance you have, sometimes insurance will even pay for, it's really hard to get that approved, but sometimes insurance will even pay for things like weighted blankets, like tension vests. So depending on what kind of insurance you have, and if you don't have insurance, sometimes you can get your kids on a waiver, and every state has different waivers. So waivers can sometimes pay for things like those sensory items that might be helpful. Waivers, and sometimes insurance, depending on what you have, pay for things like music therapy, which is horse therapy. Like there's so many different types of therapy. I know a lot of times, you know, because of movies and just kind of psychiatric history, you think of therapy as laying on the couch, but that's not really therapy. There's lots of different types. So insurance definitely can pay for a lot of resources. They don't, you know, obviously pay for everything, but definitely you could tap into a lot of resources through insurance.
Awesome. Does anybody else want to add thoughts on that question? Okay. Next question is, how do you convince someone with ADHD that lying and or avoidance is not the best way to handle a situation that makes them embarrassed or may have consequences?
Good question. Question that comes up a lot. If it's a kid, might be developmentally, I cannot speak today, appropriate. So kids are going to try not to get in trouble, right? And so we kind of look at that as willful lying, which some kids do willful lie. But a lot of times it's not even like intentionally, like I'm lying because I want to lie. Like they're just trying to avoid consequences, because that's what kids do. Like that's just developmentally appropriate. So learning, so when I want to replace a skill, I try to focus less on that skill and more on replacements. So learning, teaching skills that replace that. So not giving a kid, or I guess an adult, a chance to lie. Like if you know the answer, don't ask the question that they can lie to you. You say, I saw that you broke this toy. Or I saw you spilled this water, or whatever. Let's go ahead and clean it up, instead of did you spill the water? And I can tell you, as somebody with ADHD, I really struggle with the whole did you spill the water thing, because that's what impulsively comes out my mouth, even though I'm a child psychiatrist and know that is not helpful. So definitely I understand that can be a struggle, but if you know the truth, don't let people lie. Just say it, and then come up with what's the step that needs to be done, or teach other ways to avoid. So if they're wanting to avoid consequences, maybe they didn't do their homework and they want to avoid getting grounded. You know, can you tell me work through why they didn't do their homework and find solutions to that? I mean, that doesn't mean don't give consequences, but also work through why they're trying to avoid those consequences too, and kind of put things in place to help with that. I hope that made sense. It's kind of rambling.
Yeah, I think this is obviously depending on who who the subject is. I think it's a different answer. Kids, adults, you know, if you're talking about in a relationship, but it's I think experiencing, you know, if you're constantly avoiding telling the truth because you're worried that of the repercussions or of embarrassment, the more you can experience those things, and actually back to just managing emotions and being mindful, being present in the moment when you are experiencing those repercussions is a big deal. I think oftentimes, and I think that right, the definition of anxiety is a fear of something that may or may not happen in the future that you haven't experienced yet. So there's like this this anxiety, this worry that comes with what you think is going to happen. But the more you practice on being in the moment and really going through what your body is experiencing when you do talk about what you did wrong, you realize it's not actually that bad. So I think if there is an exercise you can put in place with adults, I'm sure with kids as well, to create that environment where it's like, okay, we're going to, it's okay. First off, it's okay to, say where these mistakes were made. But while we're going through this process, while I'm upset with you, while somebody is upset with you, experience it, be there feeling everything. Rather than trying to avoid all of those emotions and those feelings, and ultimately avoiding the situation in the first place by not being truthful. So yeah, I think that was a little roundabout, but just coming back to being present, I think helps in that situation a lot.
So I just want to say, I watched 90 Day Fiance. I don't know if we have any 90 Day Fiance fans, but I watch all of the 90 Day Fiance spinoffs there are. But there's a couple on there called Ariana and Benny. Benny seems to be, it's reality TV, a really good guy, but he lies a lot. And it's very obvious I don't know if it's very obvious. Maybe it might be obvious to me because I'm a psychiatrist. But his parents died when he was younger. He was raised by his sisters. He has a lot of conflict avoidance, right? So he lies a lot to avoid those consequences. He doesn't want people mad at him. Now, as a romantic partner or sibling or whatever, I think it's fine to say put those boundaries in place. Like, I'm not going to tolerate you lying to me. If that's something that's happening, you need to go. He needs to go get therapy for his abandonment issues because his parents died when he was young, and he doesn't want to lose anybody else. That's not necessarily your place to put up with the lying because there's a reason behind it. Like, it's fine to put boundaries in place and say you need to get therapy. If you don't do that, like, I can't be a part of this. I think a lot of times people use and not even necessarily, sometimes willfully, sometimes not, but people use their mental health or their disability or neurodiversity as this is the way I am, I can't help it. But you don't have to allow abuse from anyone, no matter what the reason or the excuse is. Like, lying to me, that's not something I would tolerate in a romantic relationship or a friendship. Obviously, I'm my kids' parents, so I can't put them out for lying to me. So we have to work through that. And if it's something that they're trying to change, that might change my tolerance to it. But if they're just like, this is who I am, it's fine to put that boundary in place and say, that's not okay. I just want to make sure people know that. I do not watch that. So I've heard about, I'm sorry, somebody put, do you watch The Psychologist that watches 90 Day? I have not watched The Psychologist, but I've heard them talking. I'm in a group for 90 Day Fiance. That's how bad it is. So I've heard The Psychologist come up in the Facebook group, but I need to tune into it to see what he says.
Awesome. Okay, so another question, and then we'll move into general questions. I'm a family physician in a busy yet understaffed OP practice. My neuro has rec to pursue accommodations, but do not know where to start or what to ask for.
Who has recommendations for accommodations?
Yeah, can you read that again?
It says my neuro, so I'm assuming.
Oh, the neurologist gave them recommendations?
Has rec to pursue accommodations, but does not know where to start or what to ask for. So essentially what we're trying to get at is, what is the best way to figure out which accommodations you need to get in place and why they would be the best for you, and then what's the best way to get started to get those in place.
So I'm going to promote myself here. I actually do consultations for job and educational accommodations. So you can always come to me. But outside of that, I think working with whatever physician you're with on developing recommendations. But once you get those, you go to HR. You go to HR to get those accommodations. And we all know, technically, federally, jobs can't fire you for requesting accommodations. That doesn't always, sometimes they do anyway. So you have to be, I guess, prepared to fight that if that happens. But I have some mobility issues right now. So I have accommodations for prescribed for my ADHD, but I also have accommodations for when I cover inpatient. I'm an outpatient psychiatrist, but sometimes we have to cover inpatient because people are out or whatever. So when I cover inpatient, I do that virtually because I can't really walk around the unit like that. And I just went straight to HR for that.
Does anyone else have some thoughts? I also have some here, but I'd like to check with the panel first. So one of the things that we have seen work really well, we have 2 master classes on this specifically, one with Dr. Sarah Allen and another with Dr. Conchetta DeCaria. So what we've seen work best so far is getting a really robust battery of tests that will determine not only the severity of the ADHD symptoms, but also of any possible comorbidities. And then with that, you need to advocate during an IEP meeting with your school with the actual documentation. So you actually need the tests with you in that meeting for getting the accommodations in place. In terms of which accommodations to get in place, it really depends on which symptoms we're talking about and your individual child or yourself. And so that's what Dr. Sarah Allen's masterclass is all about, and figuring out through what she calls brain buckets, how to figure out which accommodations would best serve those specific symptoms. So there isn't a one-size-fits-all approach here. It really does come down to getting those tests done, setting up the IEP meeting, and then also understanding which accommodations will be best for you. Okay, so I'm going to move to some more general questions. We have so many questions here, and I would love to address all of them, but we won't have the time. So there will be opportunities to connect with us in the future, and we will definitely be having lots of other live masterclasses. So be sure to sign up for those, and we will hopefully get to all those questions. One of the questions that I have for all of you that anyone can answer is, what would you say are your top 3, or anywhere between 1 to 3, biggest lessons that you want listeners to keep in mind, whether that is a health professional for kids with ADHD, educators for kids with ADHD, parents for kids with ADHD, or just people with ADHD moving forward?
I can start, well, I'll give you one and then see if the other 2 pop into my head. But going back to what I've mentioned a few times, which is being comfortable with the idea that you can, you can construct your environment around you to work for you in any way that you like, and just because it's not, it doesn't look like what your neighbors looks like, that's okay, right? Like go as in-depth as possible, go as detailed as possible to create an environment around you that allows you to work best. And one caution is, like, when you Google, which you inevitably will as you're coming up with ADHD, as you Google ways to manage some of your issues, take it with a grain of salt, and know that, like, typically that point that you're going to continue to see on every article that you click on, like make lists, use your calendar, like that's just the tip of the iceberg. There's a lot more to that you're going to need to build around in order to have a system that works for you. So if you come across make lists, which you always will, you hear it all the time from people, and you start to do it and it works day 1, day 2, day 3, day 4, you stop doing it, like, that's okay. It doesn't mean that making lists is not the answer. It just means there's more to it that you need to create, and that's totally okay, right? And it can be as seemingly menial as possible, but if there's a detail that you need to include to make it work for you, just be comfortable with that idea. You're going to create your own bespoke system. It's going to look different than anybody else, and it doesn't matter if you have on that list, grab coffee filter from cabinet and put in coffee maker, put coffee grounds in that in the coffee filter, which is literally something I have on a list that I have for my process for making coffee in the morning, you know, that level of detail. If that's what works for you, that's what works for you. That's it. So that's one. I'll come back to you with two more.
That's okay. Thank you, Eric.
Yeah.
I know it's always me asking this, but can you repeat the question one more time?
No, no worries. So just 1 to 3 lessons that you would like to impart to all of our attendees, whether they're health professionals, educators, parents, or just people with ADHD moving forward.
I'll give.
Oh, go ahead.
Oh, sorry. Oh, sorry. You can go first. Yeah. Sure. Okay. I was just going to say one profound one that I have is learning to accept yourself for who you are is very profound and very important, especially when you're neurodivergent, especially when you think differently. You might have idiosyncrasies or traits that differ from others. I've seen so many people that have this internalized shame that's built up as a result of, you know, their symptoms throughout their life. And also they also feel kind of alone sometimes because their friends might not fully understand what's going on with them and their internalized experience that's happening. So as a result, yeah, the shame can sometimes build up. So learning to love yourself and accept yourself for who you are can help kind of dismantle and dispel this internalized shame that builds up. And it's going to help, again, just with emotional regulation as life goes on. And when negative things do happen, you know, we all have ADHD, life happens. This is just going to help not let us go into those reflexive shame spirals when it does happen. Self-acceptance.
And kind of tagging on that, similar to that, finding your people. This is what I tell my kids, when I say kids, my patients, my actual kids, you know, people that listen to my, you know, podcast or whatever, finding your people. I think intuitively, I somehow throughout my life had a lot of friendships with people that were neurodiverse before we knew what that was. And so a lot of times I meet neurodiverse people that have really difficulties with friendships, and I don't necessarily have that experience, but it's because I look back and I'm like, oh, they were neurodiverse. Or sometimes like just in the Black community, we're a little bit more acceptance of like weird people. So like one thing I noticed that I kind of looked back at is if I got overwhelmed at a party, I would like literally disappear to like the owners of the house, somebody's bedroom or something, and like watch TV or read a book or recoup, and then like come back out and join people when I was ready. And everybody let me do that. Like everybody let me do that. And I can't imagine like in other, you know, cultures, just like, hey, I'm gonna go chill in your bedroom real quick. And so I never noticed that like, hey, I do have social difficulties. It was because it was just like everybody let me be weird and it was fine. But finding your people, especially if you didn't grow up with that, is just so it's just finding your people. You feel at home, like you have people that are going through what you're going through, and you have people you can run ideas off of. Taking care of your mental health, whether that means in whatever way that means, whether that means therapies, medications, you know, healthy lifestyle changes, whatever that means, but taking care of your mental health. So funny. And no, I think I'm the third one. I'm agree with Dr. Druet, just being proud of who you are. Like I'm very proud to be ADHD, autistic, female, Black. I wouldn't say I guess I'm proud to be depressed, but I'm not ashamed of it. So I talk about it a lot. So that helps with like stigma, but just being good with who you are. Like I'm good with who I am. And it took a while to get there, but I am good with who I am.
I love that. And yes, so I guess for me, very similar to what Dr. Rupert said, actually, because like I said, I got diagnosed later in life, so I didn't even know ADHD it was like a huge realization. Like it's honestly like a breakthrough, because all of these things I previously associated with like negative, bad personality traits that I got made fun of or I found to be difficult, I found they're related to ADHD. And that's actually why I started creating content. I'm not promoting myself. I'm just saying I started creating content on social media because I noticed like, oh, hey, this stuff is like really affecting me. And then that's how I've actually like found a community. And that's like really like finding your people, be around people who support you, who also hold you accountable, but also tell you how it is. Because the accountability is key. And that's like lesson number 2. The number 1, well, I guess the number 2 way to that's helped my ADHD is accountability from my friends, from my family, and from myself. And I live alone actually. So like accountability for myself, like what that looks like is like using a time lapse to help hold me accountable for cleaning or hold me accountable for studying. Like, and that's actually why I make videos and all of that, because it a form of accountability. That's just a good tool. And then lastly, use technology to your advantage. Like we mentioned at the beginning, use your phone, find like alarms, eating a breakfast. Like you'll notice there's a lot of similarities between your eating stuff, your eating routine, and then also your ADHD. And you'll feel better if you start like incorporating exercise throughout your day and doing like small things. Sorry, that was like all over the place, but hopefully that was like helpful.
Awesome. No, thank you so much, everybody. So we do have a big surprise and something for everybody who stayed all the way till the end. But I want to thank all of these panelists for giving us so much of their time and answering all of our questions so amazingly and so valuably. So please say thank you in the chat, and we will say bye. We don't want to hold you any longer than we already have. Have a great day, a great rest of your day and week, and we hope to see you again soon.
Thanks,
Thank you
Adrian.
so much
Thanks,
for having
everybody.
us.
Thank you.
It's been a pleasure.
All the best, guys. Have a good one.
Great talking to you. Bye.
Bye.